Hmm.
So you are talking to a medical student named Ahmad who has been assigned a project for presentation for clinical governance. He has a seminar
Hmm.
and he wants some help from you. And
Okay.
you are a third year registrar.
All right.
You
So
need some
let's
time.
start. Yeah, set the time.
Okay. Dr. Jayaprakash, do the needful. Okay. Start.
Okay. Hello, good morning.
Good morning, doctor.
I'm Dr. Hiren, one of the doctor here. I think Ahmad, you know me. We met before during the round.
Yes, doctor. Actually, I was looking forward to meet you, and I really appreciate knowledge during the rounds. So I thought you might help me for one of the projects which has been assigned to me.
Thank you very much for your kind word, Ahmad. Yes, today we will discuss about the clinical governance which you are interested in. Let me tell you, Ahmad, you choose a very nice topic, and really, I appreciate your interest into this topic. So, Ahmad, how is your posting going on in the pediatrics? Are you enjoying?
Yes, doctor. I'm enjoying. I'm learning new things, and these presentations and all are keeping me busy. However, this topic is something which I have not read during my uh, routine books. It's not available, the information. It's quite new to me. It will be better if you
Yes,
can give
yes.
me some insight into this.
Yeah, no problem. Today, we will discuss this and stop me in between wherever I'm not clear. And
Yes, yes.
Ahmad, I wonder if your friends and colleagues, if they are interested, they can also join us.
Actually, doctor, I am presenting a seminar, so they will listen during that seminar.
Oh,
So,
that's fine. That's fine. Yeah, no problem. So, what so far you know about this topic called clinical governance? Have you read about this?
yeah, I tried to read this out through some of the books, and I have got some idea that this is something like related to patient care and some research and something like whatever things we are doing, we have to assess the things again and again so that the care improves, something like that. But I'm little confused.
Yes, what you mentioned is absolutely correct, and I really appreciate your knowledge that it is absolutely related to the patient care. Basically, it is uh, umbrella of the framework through which NHS is accountable to provide the best healthcare to improve the quality of the patient care. It's difficult to put into the word, but this is what the clinical governance about.
Hmm.
So it has some component. Do you know what are the components through which this framework NHS maintains or the provide the best health care for the patients?
Actually, doctor, I know there are 7 pillars, but like I'm a little bit confused, like how these pillars help to achieve the clinical governance.
Right, right. So let's discuss each pillar. So there are like the 7 pillars. It contains of, for example, transparency and openness, clinical audit, guideline, risk management, and the staff education. So let's discuss one by one. Let's just start with something like audit. You might have heard about the clinical audit.
Yes, doctor. Last time I presented seminar on audit. I know about it.
That's brilliant. Yeah. So what is audit, Ahmad?
Audit is like comparing our clinical practices with the standard and do the needful changes if they are feasible.
Yes, absolutely right. What you said is correct. So, audit is one of the pillar through which the NHS they compare the what is the current ongoing practice and what is expected standard through collected evidences through the research and the studies. So this is one of the very important pillar of the clinical governance. And second pillar is research and development. So uh, can you tell me what does it mean?
Research is like finding new things, invent some new treatment modalities, maybe some instrument or some guidelines like that.
Yes, so this is something finding about new things, which like a new knowledge, which could be in relation to the development of the guideline or protocol, or for about any kind of a new medicine or new procedure. And there is other component called clinical effectiveness.
Mm-hmm.
What do you know? What does that mean?
Yeah, I feel the treatment should be effective, something like that. I don't have any idea about this.
Yes, whatever the treatment and whatever the procedure, let's say, for example, if we have a proposal of any treatment and budget for, let's say, ICU setup. But if that budget, procurement of this instrument and the establishment of the new guideline, if it is very, very expensive and if it does not become effective
Minutes.
to put into the practical scenario, then it is not effective. So whatever the treatment which we implement, it should
Mhm.
be effective into the given setup.
Yeah, I got your point of it. I want to know how the staff management can be done and how does it help to improve patient care.
Oh, that's a very brilliant question, Ahmad. Staff management is very important in the healthcare profession. In the sense, like, different area of the healthcare profession or the hospital, let's say ICU or in the emergency, they need adequate strength of the staff because they work 24 by 7 and in the shift work. So
Mm-hmm.
if the staff number is not adequate, then it compromises the quality of the healthcare. At the same time, staff management also includes the proper staff, proper person who is, let's say, somebody who is a skilled in the operative area should be assigned onto the operation theater, and those who have a skill in, let's say, intensive care should be assigned into that area.
Mm-hmm.
So staff management is a actually vast subject, which also needs includes like some element of the human resource
Mm-hmm.
also. But basically, this is an element which is very important to be addressed
Mm-hmm.
when we talk about the clinical governance. I hope I have answered your concern.
Yes, yes, doctor. But I want to know who is responsible to exhibit this, or who is responsible for managing this clinical governance.
Yeah, this is a very good question. It is like a framework, which it's a kind of umbrella, which like the whole body is there from the top to bottom. By saying what I mean is like there is a GMC council, there is a NHS trust, there is a hospital administration, some body of the government. These all are a part of it, and
Okay.
they are the one who assign the different, um, the setup for the different type of the decision regarding, let's say, the number of staff, qualification of the staff, as well as the guideline. So
Okay.
it's not a one person, but it's a
Okay.
system
Mhm.
which includes the body of the government and the trust itself.
Your time finished.
Okay.
Okay,
That's
so
good.
yeah, I think I gave a lot of information today, Ahmad. It would be nice if you can, we can go together into the library and we can find some document about this, and we can make a seminar together. I think you are already preparing for this. If you find any further information, we can arrange a next meeting.
Yeah, sure,
Does
doctor.
that
Sure. And
sound?
I really want to thank you for clearing my all doubts. In case if I have any further, I will come back to you if you don't mind.
Yeah, yeah, sure. Thank you very much.
Thank you.
Thank you very much, Ahmed, for your time. Thanks.
Yes, Hiren, it
Yes,
was
Sandeep
good.
bhai.
Like introduction, little lengthy, but it was my actually mistake. Like I asked a few questions during introduction only. The important thing, like I did not disclose you the topic. You like as we have decided. That's why you know the clinical governance. This mistake will not happen in the exam. Before I introduce my tell my topic, you say like let's discuss clinical governance. So
Hmm.
it was like beforehand before telling the
Hmm. Hmm. Hmm.
other thing like when we start with the pillars you should be able to enlist all 7 pillars. You may not complete
Hmm.
all those later, like during the discussion you may be able to finish 3 or 4 only, but at least you should able to enlist all 7 in one go. Like
Did
take
I
a
not
summary.
mention the all?
No, you did not mention all. I have sent one
Uh-huh.
document, like I have written the notes about this, and there is a mnemonic also, parties karke. So you can go through it. It will be easy to remember. Hmm?
Hmm. Actually, to be honest, I found like the one I just saw in the group is slightly different than what is given in the this Montasir book.
Mm-hmm.
Montasir book, he mentioned like I memorized one mnemonic like a torque. Torque like means transparency and openness, teaching, research, C for clinical effectiveness, A for audit. Um, so
Actually, whatever I
they
read,
have like
they
clinical
have,
guideline and all. They have not
whatever I
included into
read,
that.
they have combined research and clinical effectiveness together.
Hmm.
Then
Hmm.
the training part, then patient and public opinion. That is one pillar you did not say. But like what the notes which I made, no, that is from recent resource. So you go through it.
Hmm.
Nothing else is required apart from that. Just go through it,
Hmm. Hmm.
and like if you have any question, then we can discuss further. Otherwise, overall good. Role player was kept
Hmm.
engaged. That flow and other things were quite fine.
Hmm. 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 Okay. Dr. Jayprakash.
Yes, in addition to just the Dr. Sandeep mentioned the points, a few points in addition to the research and the added effectiveness, but the evidence-based medicine, that is also important. That is also part of in this comes in under umbrella of this
Yeah,
clinical
that he
governance.
said like effectiveness. It should be the treatment should be effective with the within the budget and with the adherent to the guidelines.
So under the
Yeah,
heading
correct.
evidence-based medicine, once we elaborate such 7 points, no? So that is one of the also heading.
No,
So
evidence-based
yeah, there
medicine
is
is
some
one pillar.
overlapping
It comes
even if in
under
the
the
Google.
umbrella of and under the heading of effectiveness.
Hmm. 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 Right.
Evidence-based medicine is not itself is not a pillar. It comes under the heading of effectiveness.
Mhm.
Yes.
Effectiveness, only effectiveness.
Effectiveness, then effectiveness. We have to explain the effectiveness. What is effectiveness?
Okay.
Like a staff management also, it's like staff education also is a part of it.
Staff education, staff appraisal, then
Yeah.
training, then
Clinical guidelines and all
uh,
this.
and,
There is some overlapping in two,
and
three
encouragement to
places.
staff
Even if
who is
you,
not under who is not performing properly, ensuring adequate number of staff, ensuring right person at right right person for right job, like like that. You just read the notes. I made the notes for myself today only. Then I thought I'll share with you all.
Dr. Tahir, anything to be added?
Yeah, actually, thank you. This topic is actually beyond my scope. One of the very difficult topic
Kind of a
to be
boring
discussed.
topic.
Yeah, really boring, very difficult. And regarding knowledge-wise, I'm sure it was full. The notes I just got through very quickly. It's a very beautiful notes, no doubt. The only thing which I can add is regarding the communication skills. I think whenever we are practicing, we are not practicing it in the real exam way. We should do it in the real exam way, like as we are sitting in the exam, because we are making this habit of that, okay, this is just a practice. No. Every communication, I think we should take it as we are real in exam sitting. There should be a bit more energy behind it. There should be a bit careful. I mean, it should be a bit enthusiasm in it.
Yes, that's a good point.
Yeah, because I have been an examiner as well, and what I see in the candidates that they are very good in knowledge, but in the West especially, what I have got the feedback from my brother, from my other colleagues, that they are very much into the communication. You might be very brilliant in education, but if you are not good in communication, I think you cannot survive there. So I think we are all of us, because we have a certificate that we have passed our theory part. So all are good in theory, no doubt. But we should improve our communication skills. We should take every topic as exam topic, and we should put effort behind it. And it should be a real exam. This is my feedback.
True. Very nice.
I have another suggestion. Like whenever we do communication, we should do with the videos open so that we can have eye-to-eye contact during this communication, and we can understand the body language of each other.
Yes.
Yes. This is also a very good suggestion. And I would also like to add upon this suggestion that along with video, if not all, at least the role player and the candidate, they should be having video on, because we know there are problems. We are sitting in home setting. So some people might not like it. So only the role player and candidate, they should face each other, one thing. And the other thing, which is really important, that there should be one examiner out of these two who should be having the checklist, and who should be marking it, that this portion was done, communication. I mean, according to just like the exam sitting, and at the end he should just say that this point was missed, this was not good, or I mean, according to the exam setting, he should give marks on the same checklist of the examiner. So I mean, it would be a bit difficult in the start. I mean, it would be a bit more time consuming or something like that, but it will be very fruitful, I think.
Yeah, this is a good, actually. Yes, I agree with this.
This we will keep in mind, because like there is a very shortage of people who are joining nowadays. So like we can initially start with the discussion with videos open, so that we will understand that like we have to talk face to face also.
True. Okay.
Yeah, because Dr. Heron, I think we should move